Okay.
Sige sir, you can start na po.
Okay. Hmm. Okay. Can you hear me? Okay.
Yes, wow.
Okay.
Yes, yes.
Yes.
Yes, doctor.
Okay. I'll now start. Okay. So let me just make a short introduction. I'm Dr. Rinaldo Ong Hoson. I graduated in the UP College of Public Health, Master in Hospital Administration in 1991. I was asked to give a lecture with this title, Systems Thinking in Healthcare Facilities, for this particular class, HA 202, with a time limit of 30 to 45 minutes. I hope I can finish this within the time limit. And then with the following prescribed learning outcomes or objectives. Number one, understand how to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Number two, understand the importance of alignment and integration in managing a hospital and its departments. Number three, describe a hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And lastly, discuss the common challenges encountered in the governance of departments together with their suggested strategic solutions. With these prescriptions given to me by the course director, I shall delimit my presentation on health facilities to hospitals only, with focus on the department rather than on the whole hospital. Thus, I will change my title then to Systems Thinking in Hospitals with focus on departments so that I will be aligned with the learning outcomes or objectives. Let's start with the structure and basic functioning of the hospitals. All hospitals are made up of many different departments and services. And we look at the hospitals as a system, that is, a set of interrelated but separate parts working towards a common purpose or goal. As hospital managers, we must know how to manage the hospital effectively and efficiently by making sure that all the various different departments and services, there are a lot, are aligned and integrated in their governance and functioning. System perspective, systems approach, and systems thinking are various terms that one will encounter in the management discipline manuals in the internet, and all are geared towards ensuring alignment, coordination, collaboration, and integration of the functioning of the interrelated parts of the system. Suffice it to say that systems perspective or approach to management views the organization or the hospital, we're talking about the hospital now, and also the department of a hospital as a unified, purposeful system composed of interrelated parts. This perspective or approach makes the manager sees the managers means the hospital director or CEO sees the organization as a whole and as part of a larger external environment. System thinking, on the other hand, is a holistic approach to analysis, mental analysis, that focuses on the way that the system's constituent parts interrelate and how systems work over time and within the context of a larger systems. Put it another way, systems thinking is basically a way of helping a manager or hospital director, CEO, to view the systems from a broad perspective that includes seeing the overall structures, the patterns, and cycles in all the systems within the hospital, rather than seeing only specific events in the system. This broad view can help the manager to quickly identify the real causes of issues in organizations and know just where to work to address them. System perspective, approach, and thinking are management disciplines that are concerned with an understanding of a system by examining the linkages and interactions between and among the components that comprise the entirety of that defined system. The bottom line of systems perspective approach thinking is the recommendation for all managers to view and analyze situations in the hospital and departments holistically and comprehensively, and to always look at the interaction of parts to other parts and to the whole and vice versa, with alignment and integration as the key result areas and key performance indicators. What is alignment? The definition of alignment given by Baldrige Healthcare Criteria for Performance Excellence, it's a state of consistency among the plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis that support key organizational-wide goals. Alignment means consistency between all hospital plans and hospital goals, consistency between department goals and department plans, consistency between department plans and hospital goals. It also means quality of doing things toward the same direction. Thus, to be aligned, all the staff should be clear about the hospital's purpose and policies and procedures, as well as those of the department, and make decisions in accordance with them. And what is integration? Again, this is defined by Baldrige Healthcare Criteria for Performance Excellence as the harmonization of plans, processes, information, resource decisions, workforce capability and capacity, actions, results, analysis to support key organization-wide goals. Integration also means harmonization between and among parts in the hospital and also in the department to produce a unified outcome or goal. So it is said that effective integration goes beyond alignment and is achieved when the individual components of a system operate as a fully interconnected units, such as harmonization of the music played by an orchestra. In effecting harmonization and integration, it is implied that coordination or synchronization and collaboration or cooperation of the parts are very, very important. This slide illustrates the concept of alignment in number 3 here and integration in number 4. The ultimate target is an integrated approach or integrated process in number 4. Number 1 illustrates the complete absence of uniform or consistent directions of the arrows or processes. You can see that all are in the different directions. So this is reacting to the problems. Number 2 illustrates some amount of uniform or consistent directions of the arrows or processes. This is an improvement of the first phase. And this is the phase of early systematic approach, which should be further developed into alignment and eventually integrated approach. As I said, the ultimate target is integration, number 4. As mentioned earlier, in effecting harmonization, integration, coordination, collaboration of the aligned parts are very important. And this slide shows the alignment on the left side. Then with coordination, collaboration of the parts, integration is achieved. And these are keys to performance excellence of hospitals. Back to systems thinking in hospitals with focus on the departments now. As mentioned earlier, all hospitals are made up of so many different departments and services. The number varies from one hospital to another. The minimum number will be the one imposed by the Department of Health licensing body. Okay. In the Philippines, I know we have a lot of foreign students here, international students. Okay. So let's just consider the Department of Health equivalent to your Ministry of Health, and I suppose you have different levels of hospitals also. Okay. So we just discussed the Philippine setting, but it's applicable to the other international hospitals. Okay. So level 1 in the Philippines means that there are only basic departments and services. And level 2 with medical specialties but without training departments, thus with more departments and services than level 1. In level 3, there are more medical specialties and with training departments, thus with more department and services than level 2. Examples of hospital and departments and services. Under medical services department category, you have the emergency room or Department of Emergency Medicine, outpatient department, and inpatient department. Under the diagnostic department category, you have the laboratory medicine, radiology, nuclear medicine, and other diagnostic departments that can be created. Treatment departments category, you have the operating room complex, OBGYN complex, rehab medicine departments, the various medical specialty departments like internal medicine, pediatric surgery, etc. And then nursing services and dietary department. And also the medical support departments category, which includes the facility management department, housekeeping department, security services, billing, and cashier department. Then the administrative support departments category, which include the quality and patient safety department, if there's one, materials management department, human resource development department, business development department, and finance and accounting department. Other departments and so other departments and services can be created on the basis of needs as deemed by the hospital administrations. So roughly, the minimum probably will be 25 departments and services, probably at level 1, and there it could be more. From my experience, there are a lot, it can go as high as 15 departments or more services, depending on the size of the hospital also. So this slide illustrates the importance of alignment, coordination, collaboration, and integration of all departments and services to effectively and efficiently achieve performance excellence of a hospital. Alignment, coordination, collaboration, okay, integration, therefore by all the departments and services, okay, thereby achieving performance excellence for the entire hospital. Let's now focus our discussion on the departments. Just as the hospital is made up of different interrelated parts in terms of departments and services, to facilitate achievement of its corporate goals, its department and service is also made up of different interrelated parts to facilitate achievement of its authorized functions and services. And each department and service is also considered as a system as in a hospital. The hospital can be called the super system, and the departments and the services within the hospitals are called subsystems. And each department and service must also utilize the system perspective, approach, and thinking in the management as in the whole hospital. That is, understanding the system by examining the linkages and interactions between the components of the department that comprise the entirety of that defined system. Viewing and analyzing the situation in the department holistically and comprehensively, and to always look at the interactions of parts to other parts and to the whole and vice versa, with alignment and integration as key results areas and key performance indicators. And not to say there must be alignment, coordination, collaboration, and integration of each department and services with the whole hospital, with other and also with other departments and services. This slide illustrates the hospital departments as systems with interrelated parts, with the hospital being the super system, with the various departments as subsystems, and the interfacing departments as co-systems. And each department is also a system by itself with interrelated parts or processes. When planning and doing problem solving, all managers should have a perspective or an analytic thinking that look at the parts simultaneously with the whole, and vice versa. And the approach should be holistic and comprehensive and systematic, using input, throughput, and output processes that consider the external and internal environment. The key result areas of the system approach and thinking should be alignment and integration of all the subsystems or parts towards the achievements of a department's vision, mission, goals, and objectives, and eventually that of the hospital's vision, mission, goals, and objectives. This slide shows the essential and basic components of a department which must be present to facilitate accomplishment of its authorized functions and services and achievement of its goals. So there are various boxes here represented by these various names: leadership, authorized functions, authorized services, goals on this side, architectural design, engineering, construction, physical structure, DOH or Ministry of Health licensing and structural requirements, policies and procedures, risk management system, human resource system, equipment and material program, data, document, records program, business development program, budget program, IT-enabled system, regular performance evaluation, and continual improvement program. All of these components must be present, all those boxes, and aligned and integrated with each other in order to achieve performance excellence for the department. On the extreme left of the slides, one sees the need for alignment and integration with the whole hospital, here, 3 boxes, whole hospital, and with the other departments in the hospital, the interfacing department. And this slide illustrates the super system, which is the hospital, the subsystem, which is a particular department, and co-system, which is an interfacing department. And the arrows indicate the need for alignment and integration of all the parts of the system, which is the department, with the super system, which is the hospital, and the co-system, the interfacing department. At this point, I'd like to disclose that this department design and development framework, administrative design and development program was developed by yours truly in 2010 to facilitate learning, planning, and administration. This department design and development framework is applicable to all kinds of departments and services in the hospital, such as emergency room, surgery department, operating room, housekeeping department, etc. To fully develop this framework, there must be a manual that contains description, the elements, and management system of each box, the so-called design and development blueprint. There are many. After the design and development blueprint, there must be evidence of implementation and evaluation of the results of the implementation. I shall now discuss the hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. On the extreme left of the framework, there are 4 boxes that refer to the hospital and interfacing departments. So whatever be the department, the administrative design and development program should be aligned and integrated with the whole hospital concepts and design, governance policies and procedures, operations policies and procedures, as well as the interfacing units, operations policies and procedures. In other words, there must be systems perspective or system thinking. Leadership. Let's start with this box. Whatever be the department, there must be a competent head with at least the following competencies: unit technical requirement competency on the specialty of the department. Usually, a department has its own specialty. Okay. Hospital teamship, meaning team playership of all the leaders, and managership and leadership. There must be at least job descriptions, job specifications, and performance evaluation system of the leaders and managers. As to the authorized functions, there must be a document stating the authorized functions of the unit. It must be complete and clear with general and specific functions, and it must be authorized by a higher office. On the service box, the authorized service, there must be a document stating the authorized services of a unit and the services offered, and the functions authorized in the document must be congruent with each other. As to the goals, here, there must be a document stating the ultimate goals which must be aligned and integrated with the goals of the hospital. So this is the goals of the department. It must be aligned with those of the hospital. The basic and essential goals are the following: performance excellence, client engagement, quality and safe healthcare services, cost-efficient or value-based services, and maximal utilization of services. And all these goals should eventually be contributing to the financial viability and sustainability of not only of the department, but also of the hospital. Now, this slide shows the basic processes of management in the department design and development framework: the input, which includes the leadership, functions, and services; the outputs, the goals, and the throughputs are all the boxes here between the inputs and the outputs. Let's now go to the throughput. Okay. DOH licensing and structural requirements. Okay. This just means compliance to DOH guidelines in the planning and design of a hospital and other health facilities, safe hospital initiatives in terms of structural, non-structural, and functional indicators, building code, fire code, local government requirements, etc. As to the physical structure, this refers to the geographical space or area in the hospital to construct the department to receive patient and as well as physician clients requesting for services, and to house the staff who will perform the functions of the department. The service requirements as dictated by the authorized functions is the first determinant of the physical structure of a department. The other determinants of the physical structure will be the following. The statutory and regulatory requirements. There are, but it all depends on the country. Okay, the Ministry of Health or DOH licensing requirements. Okay, specifically in the Philippines, we have the DOH guidelines in the planning and design of a hospital and other health facilities. And we also have the Safe Hospital Initiative in terms of structural, non-structural, and functional indicators. And of course, the building codes, fire codes, and other local government requirements. Specialty requirements is also another determinant of physical structure, particularly on the requirements of training and research, human resource program, equipment and material program, data, document, records program. Okay, should also be considered in the physical structure, budget program, risk management program, business development program. And also the quality standards, community expectations, efficiency, caseloads of the department, and lastly, probably the most important, the owners want what they want. Now, as to the architectural design, engineering, and construction, this will be dictated by the DOH licensing and structural requirements and the physical structure requirements. So you have to fulfill the basic requirements, but you can add some more. In the human resource program, there must be a document showing the job descriptions, job specifications, and performance evaluation system of the human resource or the manpower, the staff in the department. And there must be a documentation of the adequacy in the number as well as in competency. Equipment and material program, there must be documents showing the adequacy of equipment and materials needed to facilitate an effective and efficient functioning of the unit in consideration of the key functions and services of the unit, statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. The box on data document record program. Again, there must be a document showing adequacy of data, document records needed to facilitate an effective and efficient functioning of the unit in consideration of the key functions and services of the unit, the statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. There must be a business development program in the department showing the presence of a structured and comprehensive program that will develop the business of the unit to make it viable and sustainable. Budget program. Again, there must be a document showing the budget that project future income and expenses of the unit, and the budget is being used as a guide for day-to-day performance and financial evaluations at planned intervals. Risk management program, a document that shows risk management program, which just means a plan and systematic process and program to reduce and or eliminate the probability of a risk that usually results in injuries, losses, and legal suits. It may also include risks with potential positive effect, like improving the business and client engagement. IT-enabled system. There must be a document showing the use of IT. One, to promote efficiency in the performance of functions and accomplishment of the services of the department. Number two, to manage information of the unit in terms of getting the information, storing, protecting, processing, transmitting as necessary, and later retrieving as necessary. To create interconnection with other units in the hospital for timely communication, coordination and collaboration in accomplishment of the services of the unit, and to communicate with the patient and physician clients both in and out of the hospital. Now, on the box on policies and procedures, clinical practice guidelines, and clinical pathways, there must be documents on this to serve to provide order for the department and also to promote standardization of all the processes and to facilitate communications and to promote effectiveness and efficiency and to provide a guide to present and future staff, among other things. The policies and procedures, clinical practice guidelines, and clinical pathways must be aligned with the policies and procedures of the hospital. So they should be reviewed and revised periodically. As a definition, standard definition of clinical practice guidelines, it's a systematically developed statements built on the synthesis of evidence which provide formal recommendations about appropriate and necessary care intended to assist practitioner and also the patient to make decisions about appropriate health care for specific clinical circumstances or diagnoses or situations. Clinical pathways, on the other hand, is an interdisciplinary plan of care among various disciplines, different specialties, okay, that outlines the optimal sequencing and timing of intervention and expected outcomes for patients with a particular diagnosis, procedure, or symptoms. And on this box, regular performance evaluation and continual improvement program. Again, there must be a document, okay, that shows a program to appraise the extent of accomplishment of the unit in its authorized functions and business plans at planned intervals such as quarterly, biannually, or annually, and to determine the areas of improvement and to act on them. Let's now go to the last learning objective, which is the common challenges encountered in the governance of departments together with their suggested strategic solutions. I put here at least 5 categories: the man, system and methods, machine and equipment, money and other resources, trends in hospital industry, healthcare, and medical sciences. Under the man category, which include the consultants, the residents, colleagues in other units, as well as the bosses, the leaders of the hospital, which include the chief of hospital, CEO, and department heads, and also the subordinates are also included under these categories. The common problems being encountered in this category, the man categories, are competencies, quantity in terms of adequacy, alignment, coordination, collaboration, and integration, and also the personality of the people involved. So suggested strategies consist of leadership and managership skills, managing your boss, manage his personality, adjust accordingly to his or her mindset and mood, the use of inter or multi-sectoral, multi-professional committee membership so as to engage everybody into alignment, coordination, collaboration, and integration. Under the systems and methods category, common problems are the lack of systematization in doing things and the lack of standardized procedures. The suggested strategies is there is a guide, licensure requirements guidelines from DOH. So we suggest that you use that to start with, and then use the quality standards as guide, such as the PhilHealth Bench Book, if there is still one, okay, or any quality standards of a country. Okay. Joint Commission International, there are various guidelines that quality guidelines standards that can be used as guides, Accreditation Canada International, okay? And then lastly, to establish policies and procedures in terms of clinical practice guidelines and clinical pathways. So these are the suggested strategies to solve the problems of lack of systematization and lack of standardized procedures. Under the machine and equipment category, the common problems are the lack of a management system of the equipment and machines, lack of calibration and preventive maintenance of machines and equipment, and the suggested strategies are the come out with policies and procedures on the management of equipment and machine, and then under the other category of problem would be money and resources. So limited resources is always a problem. It won't go away. So suggested strategies will be the leader should be innovative in how to get the money. And lastly, under the trends in hospital industry, healthcare, and medical science category as a common problem. Okay. So the most common problem is the rapid changes in the trends, which oftentimes are difficult to cope, especially for the last probably 15, 20 years. The changes are so rapid, especially in technology. So suggested strategies are come out with a knowledge management system in which you constantly track and continue the developments, the new trends in the industry, and conduct continual education for your staff, and then do benchmarking with other hospitals, not only within the country, but also all over the world, and then being innovative. I'd like to end my lecture by flashing again the topics that I have covered. At the end of the session, understand how to run and manage a hospital effectively and efficiently by systematically using systems approach, perspectives, and system thinking. Importance of alignment and integration in managing hospital and its departments, and describe a hospital department, the design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And then lastly, discuss the common challenges encountered in the governance of the departments together with their suggested strategic solutions. How to run manage a hospital effectively and efficiently by systematically using the system approach or perspective and systems thinking. So try to remember this as a tip, okay? Try to remember these slides that I just showed you. Okay. I won't repeat it anymore. Now, for the second objectives, importance of alignment and integration in the management of the hospital and its department. Okay. So take home reminder, okay? Just take note of this slide showing the pictorial differences between alignment and integration and the steps towards a mature process approach. The ultimate target is integration. Then remember also this slide that illustrates the importance of alignment, coordination, collaboration, and integration of all the departments and services to effectively and efficiently achieve performance excellence of the hospital. And how to use it for this one, how to use it. Okay, so remember this table, okay, this framework. It is generic. It is applicable to all departments, all. It is comprehensive. It facilitates learning, planning, and governance of a department. The only things to do now is just put in the details, the contents in each box, and compile them into an operation manual. And lastly, to remember the fourth objective, the last objective. Okay. So just remember this table, starting table with 5 categories: man, system, methods, machine, equipment, money, and trends. Okay. And recall the common problems under each categories and my suggested strategic solutions. You can add more as needed based on your settings and circumstances, particularly on the strategies. So I really hope you have acquired the prescribed learning objectives through my presentation. This ends my presentation now. Thank you for your kind attention. Okay.
Okay, thank you, sir. So, do you have any questions to our speaker? Sir, may chat question si Isa. Can I read it to you, sir?
Okay.
Okay, so this is the question. Just would like to ask, how would you address the tendency of some institutions that have preferential allocation of budget and resources to a certain department, like on the basis of the specialty of the hospital administrator or income generating capacity, etc., while other departments are left to make do with their limited resources?
So, well, it's hard to, I mean, the challenges will be on the produced by the leaders of the hospital. No? Okay. So it really depends on their perspective and how they make decisions. Now, if you have any uh, grudges or you have any complaint, you just have to, as I said, one of the common problem in the man categories is that you just have to manage your boss, okay, your leaders, and then probably take the opportunity if they are probably in a good mood, just try to convince them of the need of your department, of your specialties. So that challenge will fall under the man categories, the leadership. No? Did I answer that question? I don't see the questions here, the chat box.
O nga sir, sa akin kasi nila directly
Ah,
mini-message bakit kaya ganun?
okay.
Yeah.
Any more
So
questions?
anybody else? Yeah.
Our
I saw somebody
international
raise
students
hands
are
again.
from Malaysia,
Yes, sir.
all.
Sir, I have another question.
Okay.
Guys, can't you type your question in for everybody to see? Sige, wait. I need to enable to send to everyone. How do I do that? Sorry.
Yeah, you put there
Yeah,
two.
there to everyone.
Everybody.
Okay, so now I made the message na to send to everyone. Susanna, can you retype your question so that Dr. Hoson can read your question? And the same goes with the others.
Yeah, throw it to everybody so everybody can see.
Oh, well, so this is the question of Susanna, no? How would the leader of a hospital engage all the heads of departments to practice systems thinking in decision?
Well, number one, the leader should start with practice believing in that concept and that principles and practice it, and then try to convince or educate the leaders within the below his ranks. No, okay. Then try to get their cooperation. No, of course you won't be able to get it overnight, but just try your best. Okay, and then keep on repeating, and then in the end, probably with discipline, with perseverance, with sacrifice, you'll be able to achieve what you want to do. Okay. Because in the end, it's very important to have systems thinking, and also the end point will be the integration, no, of all the units inside the hospital. In all the accreditation of all the hospitals using the JCI, ACI, the Joint Commission International, okay, they always look at the integration. Okay. So in the National Quality Awards, I think you have one in Malaysia. We also have one in the Philippines, the Philippine Quality Awards. Now, they put utmost importance on the integration. And also they look at the results of the integrations. Any more
Okay, is
questions?
that okay, Susanna?
Susana type in already. Okay. Did I answer your question now?
We can't hear you, Susanna. You're muted. There you go.
It's really
Sometimes a challenge to engage.
really a challenge. It's not easy. Okay.
Sige, any other questions from the group? Systems thinking mindset is very very important actually, no, and this is a very academic way of managing, actually, of learning, a style to learn and apply in your in the hospitals that you manage actually. Dr. Kashin, please go ahead and ask your question.
Yeah, hi sir. I'm just wondering if there's any, what do you call that, suggestion or ideas, how can we objectively measure? Is there a measure for integration? How can we assess the current level of what do you call that, integration?
Okay.
Are there any tools that we can use to measure how our current organization is functioning? Whether is it disorganized or is it has it achieved some form of integration? Is there a tool that we can use?
I'm not familiar with a specific tool, but I guess there are. But eventually, it will boil down to observation of what's going on inside the hospital, inside the department, and also in terms of a particular care of a patient. No? Okay, so when there is an accreditation by the external organizations, they usually take a look at what's really happening. No? Is there really evidence of integration? No? Okay. But prior to the as a preliminary to the integration, probably the requirements is that you must have a standardization of things, the processes that you have to do inside the hospital, and then in the manual that you will be creating, you should put you put some emphasis on the presence of integration, meaning what it's a particular personnel or specialist will have to do in relation to the others. No? Okay. So it's more of a multidisciplinary approach. No? Okay.
All right, thank you, sir.
You're welcome.
We have chat in questions, sir. No? First is from
I guess,
Aylmer.
how important is the business development program in non-profit institution or state-run centers? Okay. Okay. Business development program in non-profit. Okay. Even with the non-profit institutions, let's state-run. Okay, we just assume that state-runs are not non-profit institutions. They have to survive also. Okay? So it's either for state-run, probably they get the budget from the government. No. But when you do your business development program, if you are not going to earn from the constituent, from the citizenry, okay, business development program here will be primarily determined by the so-called maximal utilization of your services. Okay, so you must show that you are maximally utilize whatever services that you will be offering and offered for free. Let's say non-profit for free. Okay, so if you have a program that is everything for free but there is no taker, that's not a good business development program. Okay, so business development program does not limit yourself to the revenue itself. No, okay, so it has to consider the utilization of the services that you are offering. Okay. Did I answer your question, Rex Hernandez?
Yes, sir. Thank you. Thank you po. Yes, sir. Thank you.
Okay. So that's a common question being asked, okay, in government hospitals. Why do you talk about business development? No? I just put it that maximal utilization of services that you have created. No? Example, you have an operating room with 2 beds, and then business development is that you must maximally utilize your operating room. Okay, there must be patients utilizing it. If there are no patients, you don't have a good business development program there. No? Okay. We are okay. Can I go to the next, Charlie?
Yes, sir. Yes, sir.
As the
Opo.
hospital administrator, we also need to manage other external stakeholders like its local leaders, NGOs, etc. Hence, system thinking approach can also be applied for them. Yeah. Okay. Okay. That's why what I presented is just the department framework. Okay, department framework consider the hospital, but for the entire hospital, it has to consider the outsiders, the external, the third party. Okay, system framework, still using the system approach. No? Okay. Do I see another other questions? Any more questions? How about okay, if there are no questions, let me just how all of us how many of you are doctors here? All?
I
None.
think
Majority? Okay, okay. So how do we apply system thinking also in medical management, physician-patient relationship? So doing a multidisciplinary approach is part of system thinking also. But make sure not just in words that there's a multidisciplinary care team inside the hospital. Make sure that they are also aligned in their line of thinking in how they manage the patient. No? That's quite a challenge. No? Because different specialists, different doctors have different mindsets to the point that even if you create a multidisciplinary team, they don't agree with each other. No? Okay. So that's a challenge that I'm posing to all of us. I don't have the solution right now. We just probably have to revamp the whole medical educational system. Okay. So, but the systems perspective should also include the management of a patient by different specialists. Okay. Any more questions?
Susanna, sir, is raising her hand.
Who?
Just answering Prof question just now about the system thinking in management of patient medically. From my past experience, actually, that's not only integrating the multidisciplinary treatment to the patient, but also treat the patient holistically as their background socially, and also thinking at taking care of their financial ability, and also make sure the smooth referral from the periphery to the tertiary level. That is system thinking in managing patient for me, from my past experience.
Yeah. Okay. So very challenging, no?
Very much, especially the social and financial part.
And also the people. Dealing with people. Okay. Okay. Okay, there's a comment here by Rex. I think the current trend and emphasis on interprofessional collaboration, education answers a system thinking approach to medical management. Yeah, it should, no? But I hope it's being implemented properly and adequately. No? Okay, thank you. Thank you for your uh, for your input, Rex Hernandez. Okay. Any more?
There are no more questions. Nobody's raising their hand. Sir, do you want to ask them any questions?
I don't. Okay. No, I just want to say it's really challenging. No, that's not easy to do a system thinking approach in the management of a hospital, especially a hospital. No, okay. But try your best. Go along that direction. If you cannot succeed, if you want to give up, then you just have to leave. You just have to you probably not have to proceed as a hospital director and just retire. Okay, but it's not, I mean, it's a challenge really. No, okay. And you have to sustain it. No, okay. So if there are no more questions,
Natasha, sir, is raising her hand, sir.
who?
Natasha. Dr. Noor. Go ahead,
Yeah.
Dr. Noor.
Afternoon, Prof. I have some question to ask. Since nowadays, we are having a lot of problem with medical legal cases.
Yeah.
Meaning the hospital are facing a lot of medical legal cases that seems to be we, like for me in my experience, become having more tendency to practice defensive medicine. So how actually we can optimize our system thinking using the system thinking, not only to practice the defensive medicine but also to emphasize or to put on emphasis on talent development and also the expansion of the service. So I think that actually when I just go through all our session today, I was thinking like whether how can we make use of the system thinking, not only to practice the defensive medicine, as to avoid, of course it is unavoidable at certain extent, but how we can make use to emphasize the potential and talent grooming of our hospital.
Okay, you use a system thinking to manage an issue like medical legal suits. Okay, so first of all, you try to analyze. It's just like problem solving. Okay, you try to analyze what are the usual causes of the medical legal suits. Okay, is it coming from the patient mindset? No, they just call it mindset. They have their own. They think of something, or is there problems with the services that the hospital is offering? Is there's probably there might be validity in the complaint of the patients, no, because of some poor quality patient care inside the hospital. Okay, so try to get to the root causes of all of the problems of medical legal suits. So that's part of system thinking. Okay, and then try to come out with solutions. No, solutions probably to educate the patient, okay, or educate the public. No, and then try to improve your quality patient care inside the hospital. Okay, and what else? I mean, there are a lot of solutions that you can make use of, but you really don't have to just do defensive medicine just to avoid medical legal suit, no? Okay, but you have to analyze, no? Now, are you a physician, Nor?
By profession, I am a medical doctor, but currently I'm the hospital director.
Okay, so okay. Now, defensive medicine practiced by physicians just to avoid medical legal suit is not really that it's not entirely correct also, no? So you just have to educate the patient or the public because of their probably they have wrong expectations. And then you try also to probably educate your colleagues because there might be doing things that will make the patients think that this particular procedure should be done this way and not that way. No, okay. So the bottom line is to avoid medical legal suit, because in medicines there's no such thing as one way of doing things. No, there are so many ways. No, so many options. No, so you discuss everything, the options to the patient. No, and let them make the decision. No, whatever they want. No, and then of course you have to coach them. Now, if they're not on the right track, you just have to correct them a little bit. And then, but if they insist on a particular approach or management, you cannot do anything. No, and then in the end, let them sign an informed consent, no, on what they have decided, no, And then probably you're free from that already, from any medical legal suit, no? So I guess the bottom line there, the most important is explanation to all the options, all the pros and cons of the procedures to be done, and then let them sign, no? That they understood that you have explained and understood what you have explained, and the document will free you from the medical legal suit. Okay. Okay. Did I answer your question, Noor?
Yeah, thank you.
Okay.
Dr. Te has a comment, sir.
Yeah, okay. Yeah, okay. Not just the physicians, but also the nurses, NAs, and even institutional workers, no? So there must be interprofessional collaboration, education, okay? And system approach. Is that what you're referring to, Michael Te?
Yes po, Doc. Sometimes, our nurses, our workers, they love to gossip also. So they compare treatments. And while they may not be addressing the patients will overhear them at the station or when they're doing their rounds. So it can lead to a lot of misunderstanding. So one of the things that we try to do is really to urge caution, not to just let go some careless words that can be open to misinterpretation. So that also skews the perspective of if not the patients, even the watchers or the patients beside them, because they also talk.
Yeah, so you just have to create some policies to that effect that those things that can lead to misunderstandings and also in the end probably medical legal suit. No, you just have to control that. No, okay. But it also occurs people outside the hospital. It can also happen. No, because let's say a patient is not satisfied with a particular doctor. Then he goes to another doctor. The doctor says, "Oh, the other doctors is not doing the right way." No, okay. So that's why what will protect you is really the informed consent. No, the explanation that you have done. No, okay. So there's a question here by Yusef. In my opinion, the biggest challenge in system thinking implementation is to get our people in the hospital to be familiarized with the concept, okay, accept it, and subsequently making it our work culture. Very good, thanks. It takes time to possible only then we can influence external stakeholders to practice it as well as for better healthcare. Okay, yeah, I agree. Thank you for summarizing it. And then again, I would like to emphasize when you go for the National Quality Awards, no, they look at those things, systems thinking, integration, etc. No? Okay. Okay.
Any other questions, class? No more? Sir, can I share the OLED here in the chat again?
Yeah, please.
So, class, I have shared, it's like a quiz, no? So this is graded, no? So please answer it. And it is graded. Can you try to open it, answer it now? Kasi, sir, I'm not sure eh. Kasi iba siya doon sa sinend nyo eh.
Okay. Can you try?
If not, if they can't open it, sir, can you share the link in the chat box?
Let me check.
Because I think this link is different from what you sent. I'm not really sure. Okay, so Dr. Cortez has been able to fill it up. So I think it's working. Okay, sige, good.
Yeah, I think it's working.
Mm.
No? February
So-
24, February 9, Olete. Yeah.
Okay.
I just opened it. Okay.
Okay, sir.
Okay. Now that OLETE stands for Online Learning Evaluation Test Exercise. Actually, strictly speaking, as mentioned by Charlie, there's a grade in it, no? But the purpose is not really to see whether you will pass or you fail, no? The main purpose is for you to master the whole topic, no?
Mhm.
Okay. So if you don't get a perfect score, you repeat it until you
try
get
again.
get perfect. So in the end, you will have a perfect score that you have really mastered the topic, no?
Mhm.
Because I'm a teacher who believe that I don't like tests also, the so-called the traditional test, no? So if a student does not get a perfect score, use let's say 70 or 80, then what happened to the rest? The wrong answers. They don't know the right answers. They just leave it at that, no? Okay. So I would rather that they know the right answers, no?
Mhm.
Okay. So if you take the OLETE, just like mastering the topics, no? So you keep on repeating it until you get the perfect score, no? Okay. So if you get a perfect score, I'll give you a certificate of completion. Okay.
Sige. So that's it.
Okay. So no more. If not, let's have a group picture taking.
Mhm.
How do we take? There are 2 pages here. Big group.
Yes, sir.
Everybody. Okay, the others are not showing their faces. Okay.
Please
So,
turn on your cameras, especially for section B.
yeah, turn on your camera. Yeah, complete page one, no? Page one.
Yes,
Charlie,
sir.
you take it also on your end.
Yes, sir. Okay, sir.
1, 2, 3.
Page 2, get ready. 1, 2, 3, smile. Okay.
Wait. I'll get the page 2. Oh, page 2. 1, 2. Okay.
Okay,
Okay.
sir.
Omar, let's call it a day.
Yes, sir. Thank you very much, sir. The students can stay for a few minutes. I have some announcement for the succeeding classes. No,
How many are they? Can I just?
15 per section, sir. These are 2 sections, so we have 30 students today.
Okay, 30. Okay. Okay. Thank you. Thank you very much. See you.
Yes, sir. Thank you very much, and bye.
Bye-bye.
Yes. So I have a few announcements